Welcome back, viewers at home. You're joining in a conversation between myself and Musa Mpore, who is a health advocate as well as an organ donation ambassador. And we're going to talk so much about his journey as well as his pedals and provinces cycle tour. Musa, good evening and thank you so much for joining us this evening.
Well, thank you for having me. Thank you.
Now, just to get a background on your story, I believe that at 22 you were diagnosed with kidney failure and you underwent a successful transplant in 2013.
Yeah.
Can you just take us back to that and how that journey really bred life into your current lifestyle?
Well, thank you once again, and thank you to the viewers at home. It was quite a difficult and scary journey being on dialysis at a very young age. I mean, just after being told that you have end-stage kidney failure. It was quite devastating. Depression came in, quite a lot of emotion, turmoil. Luckily so, in less than a year and a half, I received a call from the hospital and they said to me, we have a kidney for you. And also that was after I had done some transplant workups where the hospital has to check you if you're eligible to get a transplant, that is. And so I went in and I received a cadaveric donor, which is a kidney or a donor from someone that has passed on, and the family said yes to organ donation. Wow. And so it really saved my life, and it gave me a new lease to life, and life has been nothing but amazing. So yeah, organ donation does save life, and I'm really grateful for that.
So much awe, because at times we see this in series and movies, and I think
True.
Sitting across someone who can talk such a story, it's like unbelievable, but
Yeah.
It's remarkable in that sense. Now, I believe with that journey, it bred a new life, not only you being able to live a healthier life in that sense, but you ended up, opening Open Eye Foundation. Can you tell us more about what Open Eye Foundation is about and how it benefits some of its, individuals who are part of it and the people who are, directly linked to some of the individuals who find support from this foundation?
Of course. I started Open Eye Foundation based on the notion that there was no information regarding education in terms of organ and tissue donation, high blood pressure and diabetes, because what it caused my kidney failure, according to the doctors, was that I had high blood pressure from my grandfather, which was quite a daunting thing, I didn't understand how come. So we then set out to say, look, let's educate our people, let's open our people's eyes to the information that they don't know, or they are not receiving. And then we set out to take out the information in many ways that we can, and also to become an advocate for the patients that are on dialysis. Also go to local clinics and teach our people about the importance of taking care of their high blood pressure, or knowing their numbers, as well as taking their medication on time and eating healthy food, or being healthy holistically, because then failure to take, once you have high blood pressure and failure to take your medication, you will end up on dialysis and needing an organ. So we felt that starting an organization that's going to take out the message, particularly to our people, it's quite important. Yeah.
Definitely it is, because usually when someone wants to look at the conversations of, I'm healthy, or sometimes there comes denial in that sense.
True.
Now, for someone who is now reading your bio and knowing your story, and now they're seeing, pedals and provinces cycle, how do these even come to be? What is it all about?
Yeah, so Open Eye Foundation is run by a very vibrant group of young people. And I believe that we need to use and do different forms of encouraging people to be either working out or being healthy while carrying out the message. So the past few years, we've done amazing work in the community where we've walked over 80 kilometers. We walked from my hood in Soweto, from Lezani to Pretoria. We walked in the Eastern Cape as well, 80 kilometers over 3 days. And now we are venturing into the cycling space, and we feel that there's quite a number of people that are exposed in the cycling scene, and we want to ensure that we take out the message through that. So we are cycling from Joburg to Cape Town over 3 days as well, since that's our mandate, to just try and encourage people to keep healthy, be healthy, and as well as understand the message of organ and tissue donation. So we are putting everything together so that people can understand and also be entertained at the same time, through sports.
Now, Musa, just to indulge my ignorance in, being someone who had kidney failure and just individuals who are on dialysis, are they able to also be part of the tour, or it's a matter of they have other ways of supporting the tour in question?
I mean, there's so many ways that you can support the initiative. Firstly, you can just post on social media, send your story out there, talk to people about it, share with family and friends as well, those that are not aware about kidney failure. Do take out your story and tell them that you do need an organ, because I believe that the more we talk, the more we share, not only do we reduce the stress and the depression, yet we are taking out the message and we are teaching more people about what we are going through as people that need these organs. Also, you can go on our website, which is www.openeyefoundation.co.za, whereby you'll find there a lot of other information, as well as our Becca Buddy donation portal, where you can go and donate and help us financially, so that we can be able to carry out the message and also do our other programs that help patients that are on dialysis as well.
Now, you mentioned that there's a lot of awareness that still needs to happen, especially, I believe, in the Black community. What would you say are some of the most, craziest misconceptions around, kidney failures or any other chronic illness, if you have any info on that?
Yes, there's quite a number of misconceptions around this topic, and I mean, people believe that because there's lack of education and people are really misinformed when it comes to organ and tissue donation. I mean, people will say that they don't want to be buried with organs that are not intact, because then when when they say when the trumpets come out, and they won't wake up and all of that. But normally what I say to all of that is that organ donation does save lives. And I mean, becoming an organ donor is being, how can I put it? I want to say homey.
Being a hero in your own
but
way.
it's just being, being, there's nothing bigger than giving yourself and saving someone else's life. I think giving someone a second chance at life is the biggest thing, and people should be looking into that and forget all these other misconceptions and things that were created to build fear in people. Organ donation does save lives, and it gives people a second chance at life, and I think people should really, really consider that. Not only organ donation, but also blood donation, because there are a lot of people that need certain products from the blood, and it's quite important that we become that nation that do and does go out and donate and register as an organ donor and just give. Yeah.
Now, would you say that's your closing message to our viewers at home? Because I'd like for you to just share a closing message and, just briefly as to, shedding light on, other kidney failures and chronic illnesses that are out there.
So in closing, for me, I really like to say thanks to families that have said yes to organ and tissue donation. Thanks to everyone that has registered as an organ donor. Thanks to all the other parties and organizations that have managed to come forward and give education and try and strive to ensure that all South Africans understand and become organ donors. The most important thing and the message that I'd like to relay here is that you are an organ donor. Just talk to your family about it, discuss it, and so that when the time comes, it's easier for them to say yes to organ donation. And thanks to everyone that has supported Open Eye Foundation till this day.
Thank you so much, Musa, for coming in and just shedding light on your journey and some of the work that you are doing within your society, and the light that you're bringing to conversations that most of the time are crowded by misconception and lack of understanding. And thank you so much for shedding light.
Thank you for having me.
Viewers at home, that was my conversation with Musa Mpore, who is, a health advocate as well as an organ donation ambassador, speaking on how information is quite key in many things, in terms of getting the help that we need or being the help that we can be.